Good morning, good afternoon, good evening from wherever you're watching, and welcome to another episode of Something About Surgery with me, Dr. Stanley Aruyaro. A few days back, I had this patient who suffered a broken thigh bone, and the relatives wanted him operating like today. Trying to explain to them that I needed to run a few tests and a few scans to understand how strong her body is to withstand surgery proved quite challenging. So today's episode will look at preoperative or before surgery evaluation of any surgical patient. Now this applies to elective or planned surgeries because for emergency life-saving surgeries, you go in irrespective of how badly the patient is to try and salvage the situation. The important thing to understand is that surgery is actually like an accident. It's like an additional injury. So when a patient is going through surgery, their body will respond to that surgery like they have been through an accident. Surgery is controlled trauma. That is why we need to assess how strong the patient is before they can go through surgery. Every system in a human body, the breathing system, the circulatory system, the digestive system, the locomotor system, name them, as a way in which they are affected by major surgery. That is why it is important to understand if this person has got any impairment of specific regions of the body before you can take them through surgery. Now, surgery is graded depending on complexity and severity. You have minor surgery, a small surgery, removing small growths here and there, maybe under local anesthesia. Then we have intermediate surgery, short surgery, maybe under general anesthesia, maybe under regional anesthesia, maybe an hour at most, and the patient can go home maybe after a day. Intermediate surgery, say hernia and repair. Then you have major surgery. It means the patient is under general anesthesia. It means the procedure will be slightly longer than intermediate surgery. And it means the affection or the heat the patient will suffer from this surgery is more than minor or intermediate surgery. Then we have complex major surgery. We call it grade 4 surgery. Surgery that enters the chest, the abdominal cavity, the brain. These complex surgeries that takes hours and hours and hours. The patient will take longer time to recover from this surgery because the heat suffered by the body is bigger. Having understood that, it is also important to understand how we grade the patient. So on one hand, you have the severity or the complexity of surgery. On the other hand, you assess the fitness of the particular patient to withstand that surgery. And every time we have a patient, we have numerous scoring systems, but a common one is called ASA classification, or American Society of Anesthesiologists classification. This tries to see how fit the patient is to go through surgery. And they range from a normal patient who is completely healthy, who therefore can withstand as much surgery as possible, to an extremely sick patient with multiple diseases who cannot withstand even intermediate surgery. Now you understand the two dimensions we look at. We look at how extreme the surgery is going to be and how fit the patient is. And that therefore says that the ideal meeting point is where you have a very fit surgery or a very fit patient undergoing maybe an intermediate surgery. That patient is going to have fantastic outcomes. On the other end, if you have an extremely complex surgery with an extremely sick and unfit patient, you are setting yourself up for failure, unless, of course, this is a life and death situation and you are milking that 2%, 1% chance of survival. Having looked at them this way, then, you would understand that when we grade a patient as fit, or having one or two comorbidities or disease processes, before we can put them through surgery, we have to do a few investigations. And those investigations will range from blood tests or scans. Now we have another grading system, very interesting, that looks at the patient's age, presence of diseases, and advises what are some of these investigations that we can do. For instance, if you have a patient with heart condition or hypertension, then it is important that you do a scan of the heart called ECG and even echo, and you do a chest x-ray. If you have an elderly patient above 65 years old, it is always advised, even if they do not have hypertension or heart disease, that you do a chest x-ray and an ECG, because we know the changes that affect the heart and the blood vessels as people age. And the investigations again get spread out system by system in the human body, depending on which system the surgeon is going to be operating on, how fit the patient is on that as a scale, as we've mentioned, and how complex the procedure is going to be. Any patient going through surgery must go through a series of preoperative investigations to establish how fit they are. And with that battery of investigations and assessment, then the surgeon is able to tell you, this is the risk profile if you go through this surgery with your fitness score. That, in a nutshell, is how we look at preoperative investigations.